This study explores Cefadroxil as an oral transitional therapy for gram-positive bacteremia. Conducted across multiple centers, it retrospectively analyzes data from 323 patients. Published in Open Forum Infectious Diseases, 2026, by Clark et al., it provides insights into alternative treatment strategies. Gram-positive cocci cause about 50% of bloodstream infections in the United States, often leading to complications like osteomyelitis. Traditionally, prolonged intravenous therapy is used due to concerns about oral beta-lactam bioavailability. However, this approach increases risks such as catheter-related thrombosis and infections. Recent randomized controlled trials, like OVIVA and POET, support transitioning to oral therapy after stabilization. Cefadroxil, a first-generation oral cephalosporin, offers over 90% oral bioavailability, making it effective for gram-positive cocci bacteremia and osteomyelitis. Its twice-daily dosing enhances adherence compared to cephalexin. With a low adverse event rate and broad gram-positive cocci spectrum, Cefadroxil remains underutilized despite a 69% prescription increase from 2019 to 2023. I can tell you from personal experience that it is much more expensive than cephalexin, which makes it much less accessible to our patients. This study is a multi-center retrospective cohort involving adults with bloodstream infections due to methicillin-susceptible Staphylococcus aureus, Staphylococcus lugdunensis, or Streptococcus species across 4 Los Angeles County Department of Health Services hospitals. Exclusions include endocarditis, vertebral osteomyelitis, and central nervous system infections. The primary outcome is 90-day treatment success, comparing Cefadroxil, intravenous only, and other oral regimens. From 1,604 electronic medical record cases, 1,183 were excluded, leaving 323 for analysis. Exclusions were due to high-risk infections absent in the Cefadroxil group, such as endocarditis and vertebral osteomyelitis, ensuring a balanced comparison across cohorts. The 3 cohorts, despite demographic differences, showed comparable disease severity. Median ages were similar, with a slight male predominance. Notably, diabetes and housing instability varied significantly. Skin and soft tissue infection prevalence was higher in the Cefadroxil group, reflecting institutional caution. Expected mortality and length of stay were consistent across groups, supporting comparability in disease burden. The primary outcome shows high treatment success at 90 days across all groups. 91% for Cefadroxil, 94% for intravenous only, and 93% for other oral treatments. Treatment arm wasn't an independent predictor of failure, but Staphylococcus aureus bacteremia increased failure odds, highlighting its virulence. The safety profile of Cefadroxil showed no severe adverse events, unlike the intravenous and oral cohorts. Mortality and recurrent bacteremia rates were low across all groups. Notably, Cefadroxil resulted in shorter hospital stays and antibiotic duration compared to intravenous treatment, highlighting its efficiency and safety as a treatment option. Treatment success rates were statistically equivalent across all 3 arms, with no significant differences in 90-day mortality, recurrent bacteremia, or hospital readmission. This supports oral Cefadroxil as a non-inferior transitional strategy. Cefadroxil stands out for its tolerability, safety, and simplicity compared to other oral options. Its twice-daily regimen overcomes the frequent dosing limitation of beta-lactams, enhancing adherence. The study's retrospective design is prone to confounding and selection bias, with baseline imbalances noted. Findings exclude high-risk infections like endocarditis. A median of 5 days intravenous therapy precedes oral switch, with early transition effectiveness unassessed. Future directions include randomized controlled trials and studies on high-risk infections and optimal dosing for patients with altered pharmacokinetics. Cefadroxil demonstrates non-inferior efficacy with 91% treatment success at 90 days, comparable to intravenous and oral therapies. It shows zero severe adverse events, indicating a clean safety profile. Hospitalization is shorter with Cefadroxil, and it offers a pragmatic oral option with twice-daily dosing, excellent tolerability, and minimal drug interactions, ideal for patients with housing instability or intravenous access barriers.